Like sitting here. Okay. Um, so we'd like to welcome you to our presentation tonight. My name is Cicely Reese, and Robin Gowrie and I work together representing the Interschool Council with Lower Merion School District. Interschool Council is abbreviated as ISC, if you've heard of that. The ISC is the umbrella organization for 11 home and school associations for the Lower Merion School District. The ISC works in conjunction with Megan Schaefer, our acting superintendent. Megan, if you could give a nice wave.
Hi,
She's our acting
everyone.
superintendent for the Lower Merion School District to plan and host the Parent Education Series. So before we get started this evening, I just wanted to review a few housekeeping items. First, to let everybody know that this presentation is being recorded. You will be able to find this along with other recordings from past events from the Parent Education Series on the Student Services Department page of the Lower Merion School District website. As the event is being recorded and with respect for our presenter, please do not audio or video record the presentation. After our speaker has concluded his presentation, we will host a question and answer period. During this time, we ask that you not include any personal information as this is a public forum and we wish to respect your privacy. Please submit your question through the chat directly to the hosts, me or Robin, and we will ask your question anonymously. You don't have to wait until the end of the presentation. So if you think of a question, please feel free to submit it and we will absolutely ask it. So tonight, the ISC and the Lower Merion School District present the December Parent Education Series, and the topic of this evening's presentation is substance abuse prevention resources and education. We welcome our speaker tonight, Cordis Sims. Cordis is a student assistant program specialist at the Caron Treatment Center, and he is passionate about substance use prevention and education. Inspired by his personal journey of recovery, Cordis understands the profound impact substance use can have on individuals and their families. He has extensive expertise in recognizing emerging trends and providing support to adolescents and parents alike. Without further ado, I'd like to pass the presentation over to Cordis. Thank you.
Awesome. Thank you so much. I am excited to be here with y'all. That was very kind. I am going to share my screen. So give me just a second here as I do that. And can y'all see that? Is that good? Awesome. So I just am super excited to be with you all tonight. Thank you so much for having me. Like Cicely said, my name is Cordis Sims. I am from the Caron Foundation, and I'll tell a little bit about us. First and foremost, I just want to say being a parent is hard. Being a caregiver is super hard. I know finding time in your schedule to sit through one of these presentations is difficult and challenging. So thank you for taking the time to listen, learn. One of the things we say at Caron is when you know more, you do better, right? And so what we want you to know is know more about this topic. So with that being said, a little bit about us at Caron. We are a drug and alcohol treatment center. We've been operating for 65 years. We are based out of Wernersville in Reading, Pennsylvania. We have worked for a long time in helping people with substance use disorder. Me specifically, I am part of the Education Alliance. And so the Education Alliance is been providing substance use prevention and intervention programs for over 30 years. We work in kindergartens all the way up through college. If you want to learn more about kind of what we do in the services we offer, there's a QR code there that you can look at.
Cordis, I'm sorry, I wanted to let you know that I don't think you're in presentation mode. It might be easier to see the slides if they took up your screen.
Is that better?
Yep, thank you.
There we go. Sorry about that. Thank you. You didn't miss anything super important on those. We'll get into the meat and potatoes of everything here in just a second. We're gonna watch a video.
Cordis, is there audio that goes with this video? Okay.
Whoa. So, um, I'm just going to jump ahead to these next couple slides here about what we're going to get over today. We have a lot to get over, so I want to make sure that we are taking some time to understand what's happening out there and going through everything that's important. So what I want to do first is I want to talk about addiction and what it looks like in the teen brain. I know, we're talking about the entire um, from the Lower Merion School District, right? We're looking at kindergarten right through high school. I think it's important to understand, how important brain development is, right, in all of that lifespan, especially with the teenage brain. We're going to look at current trends in teen substance use. We're going to look at that specifically with as it pertains to Lower Merion, right? And as that, how y'all compare nationally and compared to the state as well. We're going to talk about some protective factors and risk factors that are for adolescent use, things you can understand and know about. And then lastly, we'll leave you with some best practices and approaches that you can do to help and intervene. So the first thing I want you to do is I want you to think back to what life was like for you, right? So when you were growing up, right, as parents and caregivers, right, what did your life look like when you were your child's age? It might have been a little bit different. So for example, how did you spend your time? Were you out, riding your bikes around, maybe going to an arcade, right? Not playing video games online. You think about how you communicated with people, right? Cell phones, I don't know how old everyone is, right? But were cell phones a thing, right? Did cell phones exist back then? I know for me, when I was growing up, cell phones did not exist, right? It was, if they did, they were not used like they are today. Right. And then we talk about this, right, and how were alcohol and drugs communicated, right? How did those conversations exist, right? There's a bunch of different programs that existed out there, and what we want to do is maybe change some of those perceptions and add on to it to help and support you. So the first question, that I want to answer tonight is, what should you know about youth substance use, and what that looks like today? So I think the important thing to understand is, adolescence and that period is so important to brain development, to growth, to personal development, to so many things that are happening. As parents and caregivers, you can fully understand the importance of that, right? And you want your kid to be successful. You want your kid to do well. During that time, right, there's lots of brain development. There's risk taking, right? And whether that looks like, asking someone out on a date, whether that looks like, maybe not wearing a helmet, experimenting with substances. It can range from positive risks to negative risks, but it is, normal during that time. It's in time to encounter new experiences, let them be better prepared. And, the big piece here that we'll talk a little bit more about throughout this presentation is the period when the brain is not yet developed. And so, the last part of the brain develops from the back to the front. The last part of the brain to develop is the prefrontal cortex. And that part of the brain right here at the front is it's so important for decision making, impulse control, the brakes, right, that can be used to stop potential harmful behaviors. So it's super important, because the adolescents and teens are so vulnerable during this time. And so during this time, it's important that we continue to have these kind of conversations with them around substances. A lot of data shows that, the age of first use is one of the reasons why people can become addicted to substances. Part of that is because it happens when your brain is developing. And so if you start using at a young age, you're more likely to, maybe have some more consequences with your substance use. So, as we kind of talked about, right, adolescence is the critical risk period for the risk of addiction. You know, you're as a, you know, there's a lot of research out there that talks about, you know, skills you learn at a young age, right? You will do better, you know, later on in life. And so it's important to understand that, you know, the young brain is so important for wiring and learning and understanding things. And so, with that, substance use during this time can cause people to become addicted. And so, you know, one of the messaging throughout this entire presentation that I'll always say is delay, 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 right? So, delay the use of substances for as long as possible. And so, one of the things that we can do is continuing to do that throughout. You know, throughout our adolescence and child's life is continuing that messaging and being consistent with what we say in delaying that use, right? Like I talked about, right? You know, no one, you know, I do presentations with kids and I often ask the kids, I say, you know, what do you want to be when you grow up? And kids will, you know, I've never had a kid say, I want to be a drug addict or an alcoholic, right? And so one of the things that we can do, right, is we can work with them to take actions and implement more protective factors to stop them from becoming an addict or an alcoholic. And one of the most important things we can do is delay that first use for as long as possible, right? So delay that use until the brain has had as much time to develop, right? And so oftentimes, right, we say that the brain stops developing around age 25 or so, around mid 20s, but waiting until someone is age of 21 will really, you know, research shows that that will limit the risk of addiction if they wait until they're age 21. And we'll talk about that a little bit more as it pertains to nicotine and alcohol and those laws that have been passed. So I really want to get into some of the meat and potatoes around substance use and what the current trends that we have that are out there. And so I think it's important to note kind of where these, you know, figures are coming from. So there's coming from a couple different surveys. So there's one national survey that's conducted. It's called Monitoring the Future, which I'll talk about in just a second. The other one is called the Pennsylvania Youth Survey. And so the Pennsylvania Youth Survey, it's conducted every 2 years. And so these trends that we have are from 2023. So they're the most recent data and trends that we have around current substance use. So I'll talk a little bit more about them, but the monitoring the future is just what's important to know about that is this is, you know, national data, and the data that I'm going to present to you will have national data as well as Lower Merion, as well as some state data as well. I will say the Pennsylvania Youth Survey, in preparation, we talked about this with y'all's school and the district in general, and they will do a presentation going over all of the data collected from the youth survey. So I don't want you to think that they're not going to go over this with you, but they are going to do that at a later date. Or maybe they have already. I can't remember which one it was, but we did discuss that they will go into more depth around this. So what is important to know around these trends and these data is these are anonymous surveys, and year in, year out, these data, these trends have been proven to be correct, proven to be accurate, and consistent across the board, right? So we know that oftentimes with, you know, there's oftentimes fear in collecting data that, you know, the youth might not respond in a way that would be honest and appropriate, but what we've seen is it is that way. What we have seen, the teen drug use remains below pre-pandemic levels. So what's important to understand is that between 2020 and 2021, reported use decreased dramatically on the onset of COVID. So that was one of, you know, if you look at maybe silver linings of the pandemic, that was one of the silver linings that did happen. So in 2022, that was a couple years after, I guess, or after the pandemic started, but schools started to reopen. These trends stayed at that lower rate. So we'll see that here on this next slide here, right? And so you think about 2020 here, those trends have kind of stayed low and stayed pretty consistent for teen substance use. So we're looking at 2023 now, for 12th graders, we're looking at 31%. of people have used substances. So I think that goes directly into our next slide, right? And talking about the good news, right? And so I think oftentimes what, kids might say, this was a common thing that I said in my household growing up is, Mom, everyone's doing it. Everyone's drinking. Everyone's using. In an attempt to normalize my drinking and drug use. What the data shows and what we see is that most youth are not using substances, right? And there's the social norms theory, which talks about how oftentimes adolescents, teens, people in general will often maximize bad behaviors and minimize their good behaviors, right? And there's research and data that supports it. But what we see here, right, is 62.6% of 12th graders report from not using alcohol or cannabis over the past month, right? And that number goes up for each grade level that it goes down. So it's important to know that, a lot of people are not using substances. Maybe they've tried it once or twice, but they're not using it over the past month. The next question here. So I think this is an important to understand and important to evaluate. It's really important to look at protective and risk factors, right? As I kind of alluded to earlier, there's certain things that we can do to protect our children, protect our youth from becoming addicted to substances. In some of these, right, I talked about it, I'll say it again, right, that delaying use for as long as possible. Obviously, not using would be our number one recommendation. We know that that's not always a reality, right? We know that's not always a reality, not using. And that can be for a variety of different reasons. A couple things that I want to highlight and point out, right, is family history. So family history is oftentimes seen with if there's a genetic component. So substance use disorder there's a genetic component to that. So if there is a family history of substance use, the adolescents are more likely to become addicted to those substances. So what we don't entirely know, research doesn't entirely know or doesn't show exactly what genes become unmasked and why they become unmasked and why some people become addicted and some people don't. But it's important to understand that if there's a genetic component, waiting until as old, until the brain can fully develop is as important as possible. Another important risk factor that I really want to highlight is talking about mental or behavioral issues, disorders that are not are unaddressed. So depression, anxiety, maybe even attention deficit hyperactivity disorder, any of those disorders or mental health conditions that someone is struggling with, if those aren't addressed, those can lead to more addiction. They have more of a risk for becoming an alcoholic or a drug addict. We talk about ACEs. There is a video on ACEs that I will include. There'll be a link to it in this. I can include that in the slide so that you can look at that as well. But ACEs are adverse childhood experiences. And so there's a lot of research that's coming out now that talks about how adverse childhood experiences, whether that's abuse, whether that's neglect, whether that's household dysfunction, anything like that, that's happening at home, right, can lead to more issues with substances later on in life. So there is things that you can do to prevent those, and oftentimes, right, it goes back to getting help, getting support, having those conversations. So in here, I think, we'll talk a little bit more about this later on at the end of the presentation, but I think, this group up here, right, and social supports and what that looks like, and having people, having people around that don't use, and parents know that, parents are very clear around, consistent around their messaging around substance use is incredibly important. One thing I'll talk about at the end as well is your child's peers' parents. So, if they're going to a friend's house, do they have similar rules around drugs and alcohol? And just having those maybe difficult conversations and making sure everyone's on the same page. We'll talk a little bit more about that later on, but I do think that's one of the protective factors, right? Is knowing that substance use is um, not encouraged. So, I think it's important to address, what are we seeing? What is the most commonly used substance? This is a question that, was asked before the presentation. What are we seeing among the most commonly used substance? Alcohol still reigns supreme. Alcohol is the most common substance that, high schoolers, middle schoolers are using. What we have seen is that there is more use of nicotine, cannabis, those kind of trends, which we'll talk a little bit more about. The most commonly used substances are easily available, right? So if you think about these three substances, alcohol, cannabis, and nicotine, right? They're legal or mostly legal. They have significant industries that are pushing for their use. And they're perceived as less risky or harmful than what people perceive as like harder drugs. And we'll talk a little bit about y'all, I guess Lower Merion as a whole, right? The messaging that you've presented around harder drugs and how positive that's been, and just continuing that maybe with some of these other less harmful drugs, right? I think it's important to note that all drugs can, be addictive. All drugs can have these impacts and can really impact brain development. So it's important to recognize that. So we're going to start with alcohol. Alcohol is everywhere. It is hard to not see alcohol on the TV. If you're watching live TV, if you're watching an Eagles game, you see advertisement for beer. You go out to eat and there's alcohol being served at restaurants. What does alcohol look like at your house, right? Is there a bar? Is there, when you go out to eat, right? Do you have a glass of wine? Do you have a beer? Alcohol is kind of everywhere. It's hard to avoid. And it is, with that increase in exposure, it can oftentimes normalize drinking and it can reduce the perception of harm. And then in turn, what that does is it makes youth feel like it's okay. Like it's okay for me to use this. And it in turn increases youth trends and youth access. The other thing that we're seeing is we're seeing a lot of flavored alcohol. So I don't know if y'all have seen like the hard seltzers down here in the bottom right hand corner here, but there's a lot of those flavored seltzers, flavored drinks that don't, taste as alcoholic, right? As other, as straight whiskey, for example. And so we've seen an increase in this and what that's done and what that's looked like. And kind of some concern around that. So I want to talk a little bit about what we've seen from the data in 2023. So it's remained pretty stable for 8th and 10th graders. So for 8th and 10th graders, the data is remaining pretty bit stable from a national average, right? And if you think out from the next slide here, we'll talk about Lower Merion School District. But 30% of 10th graders have said they've used in the past year have reported using alcohol use in 15 and 8th grade. That number for 12th graders is declining slightly, which is good from a national standpoint. What I do want to talk about, right, is here at Lower Merion School District, right? And so what that looks like. So your column here is in I guess it's all kind of gray and blue, is in that LMSD 2023, that singular column going down here. And I think what stood out to me when I was looking at the data and looking at this was you at Lower Merion are higher than national averages, higher than state averages as it pertains to alcohol use. This is the one area that you are where this trend is true, right, around alcohol lifetime use, and what consistent, right? And so I think what's, there's other, areas maybe, but for 10th, well, excuse me, 12th, 10th, and 8th grade, there's consistently higher, and not just a little bit higher. I guess 12th grade is just a little bit higher for the USA, but the other numbers are higher than that. And so I guess, questions that I just want to propose to you, right, is what is your messaging around alcohol, right? What do you say around alcohol? How, would your child know what you think about it, right? If we were to ask them independent of you, what their thoughts were around that, would they know your thought on that? Um, and the other question that I had was, do the other students' houses, that your child might be going to, do their parents, do their caregivers know your rules and your stances on alcohol use disorder, or sorry, not alcohol use disorder, alcohol use? And I think it's important to know. I do these presentations. I talk with parents sometimes and have these conversations where some parents think it's okay for their child to drink, and their friends to drink when they come over, as long as it's under their supervision. And they might not know, right? You as a parent might not know that your child is doing that, or it is okay if the parent is there. And so, I guess my, question to you is, have you had these conversations? Are you, is it something that you are okay with, right? Is this a conversation that you've had? Like, I do want them to, if they're going to drink, I'd rather they do it under my supervision. We're going to talk a little bit on the next slide around kind of some concerns with that, but I do want to, pose some questions around that, right? And if we see, you know, you as Lower Merion School District, right, your view around alcohol, and as the parents, I know you all don't, you all have different opinions, right? You're all parents in that own self, but what are your opinions? What are your thoughts? And making sure that you're clear on those. Why I bring that up, right, is because underage drinking, what we see is when youth drink, they tend to do so more intensely. They might not be given as much opportunity to drink, right? It's not often as easy to get as adults, or easily to use, right? Maybe they're trying to hide their drinking. And so oftentimes they have the goal of getting drunk. And so what we see is that 90% of all alcohol consumed by youth is in the context of binge drinking. And so what we see is that youth who drink are about twice as likely as adults to meet clinical diagnostic criteria for an alcohol use disorder because of binge drinking. So it's important to understand that, there is criteria, right, for alcohol use disorder, and oftentimes that the youth can meet that criteria because of how much they are consuming, and then the impacts that it'll have on their impairment, either that day or the following day, or their relationships as a result. This last little data point here, right? I didn't go into all the numbers. I believe the national average was right around 10% of seniors or 12th graders reported binge drinking. It was a little bit higher here at Lower Merion at 11.7%. So they had 11.7% of seniors reported binge drinking in the past 2 weeks. So it's important to understand that, and what that looks like, right? Are they going down to the shore? Are they doing it at a house party? Are they doing it, in the basement? Are they going to a park, right? What does that look like? And so just being mindful of that, right? Because there's a lot of health risks that can happen from binge drinking. Oftentimes when people are inebriated, that's oftentimes when we see serious medical issues kind of happen, whether that's, physically, or getting behind the wheel of a car, or sexual assault, things like that, that can happen when people are have engaged in binge drinking. So limiting binge drinking, I think, is one of the most important things that we can do. It is, it takes not just one person, right? It's as a collective group being mindful of that and being aware of that to limit risk, right? Which is important. So this next slide here talks about, alcohol and how it impacts the brain, right? And the impact on the youth in general. Alcohol is toxic to the adolescent brain. It will impact and interfere with healthy brain development. Waiting and delaying until that brain is fully developed is super important. We talked about how the last part of the brain is the prefrontal cortex, right? That impulse control. And oftentimes, what alcohol does affect is it affects that prefrontal cortex, and it can really impact and reduce that impulse control, and reduce inhibitions. Going here too towards self-harm and suicidal behavior, it's important to be mindful of that and goes towards, like I talked about earlier, those risk factors is those untreated mental health disorders, that is super important to address. So again, this top right bullet point talks about, or I guess not bullet point, paragraph talks about worsening symptoms of anxiety and depression. So how substance use can impact that and can cause that. Alcohol is a depressant, right? And so it can impact that and cause people to be more depressed if they're using alcohol, and can increase anxiety as well. This last stat here is important to know. Youth who start drinking before the age of 15 are 5 times more likely to develop alcohol dependence. So again, as I alluded to, delaying that use for as long as possible, having those conversations is super important. So I'm just going to briefly go over this slide. 21, right? 21 is for alcohol. 21 is the new law for tobacco. So we'll talk here about tobacco, but I think it's important that 21 is that age, right? We can delay towards 21. 25 is the best, but 21 would be really great to aim for. Vaping. So we're going to take a look at vaping. And so if you're not familiar with vaping, vaping is essentially inhaling and exhaling an aerosol, often referred to as vapor. It's produced by an e-cigarette or a similar device. So what we have seen from the National Youth Survey, about 2.8 million youth currently are using any tobacco product. That's actually a decrease in high school students, but an increase in middle school students, that we've seen from nationally. Those that do use, those youth who report current use of an e-cigarette, more than 1 in 4 of them use that e-cigarette daily. So those that are currently using, a quarter of them use daily. The most popular brands are disposable ones, Elf bars, and I'll show you a video here in just a second that shows just how some of these might look and are more covert, more concealable, and really about kind of getting away with it. Like I talked about earlier, right? When people used to, smoke cigarettes, it was very obvious that someone had smoked, right? From the smell and kind of stays with them, with that. With vaping, it's, what we're seeing is a lot of these are flavored e-cigarettes. So almost 90% of them are flavored e-cigarettes. And so it really, that smell, it smells like peach, it smells like mint, smells like lemonade, and it could be a variety of different things. You might not even know that your child is vaping. So this is just super important. This is, again, kind of what I talked about, what I had alluded to on that last slide, and kind of going over that. And so, yeah, what we see is oftentimes they'll use the disposables. What we'll see is that, sometimes they might not even know what they're vaping. They'll find a disposable on the ground and pick it up, and do that. That's oftentimes the case with younger, middle schoolers, right? That they see someone doing it and they'll do it that way. But oftentimes, the older adults, right, will either have someone or find a way to buy it in that way. Most of them are flavored. So we're going to watch just a brief video here. There's no sound that you need, so I'm just going to play it real quick. So some of that data has changed. Some of those products have changed, right, as the FDA has cracked down on some of the regulations around that. Puff Bar and Elf Bar are two of the most common ones that I've seen in schools. Right, they're disposable ones. They use them. They contain a lot of hits. They are. I'm going to be honest. I used them. They're delicious. I don't vape anymore, but I did, and it's gotten a whole new generation addicted because it tastes like candy. It tastes delicious. It tastes good. And they don't really know what they're putting in to their body, right? Which I'll kind of allude to in just a few slides here, or talk about in just a few slides. So these are a couple reasons why people might vape to begin with, right? That friends use, right? If they have somebody, goes back to that who they're hanging out with, right? Or do they have people that are using constantly? That curiosity piece, that's another big one that I think is important to kind of know, and that maybe could be addressed by having some of those conversations around it from an early age, around nicotine use and vaping in general. And I know it's a little bit more difficult, right? Because vaping wasn't around. I wouldn't think, right, for the majority of y'all when you were growing up, and so you're unaware of kind of the impact that it has. But they market to kids, they market to the youth, really trying to get them addicted, get them started early so they can get addicted and get a customer for life. So here are some other reasons. I won't go into all of them, but it's just important to know why they're using these substances. This next slide here is something that we've seen as well. This is something that's pretty interesting, kind of as it, what I kind of talked about just a few slides ago is concealing their nicotine use, concealing their substance use, right? If they know that you disapprove of it, they might try to do it in a way where they won't, their parent or caregiver might not know that they're using. So what we've been seeing recently is we've been seeing some of these oral nicotine products. This is different than chewing tobacco, where you have to spit. Oftentimes with these, you can just swallow what is, the your saliva with it. They're not prescribed therapies for smoking cessation. So I think that's super important to note. Some people will be like, oh, it helps me quit. You're still using nicotine. They might say, oh, it's healthy. It doesn't have tobacco in it, but it just, it has very high nicotine content. So these things are very prevalent, very concealable, very easy to kind of hide, similar with vaping. So important to understand what these are, what these look like, so you can be aware of them. The nicotine risks, right? So a lot of these risks are similar to, any substance use, but nicotine addiction. So, as talked about earlier, I'm in recovery. I've been sober for over a decade. And, the hardest substance for me to quit was nicotine. And part of that was because it's just slowly kind of killing me. I knew the immediate impact wasn't there, but slowly over time it is there, and it's the most addictive substance, if one of the most addictive substances. It's right up there with heroin and cocaine. So it structurally changes the developing brain. It alters the way the brain functions, the brain wires, the way the brain grows. It can increase the risk of addiction to other substances. So it's super important to understand that. It's super quick to get on these. Oftentimes what we see with these nicotine products, vapes, is that individuals will just use them routinely, right? And what happens is they might think, oh, this is helping my anxiety, right, when I use the nicotine. And oftentimes what they're experiencing is withdrawal from that. Nicotine's a stimulant, so it'll oftentimes they might hit it all day, and what ends up happening is it increases their blood pressure, their respiration, their heart rate. And then when they stop using, they start to experience some maybe anxiety, or some struggles paying attention. And what's ending up happening is they're addicted, and it's these withdrawal symptoms kind of happening for them. So it's important to kind of understand, as parents and caregivers, what nicotine can do to the body and the brain. Cannabis. this quote on the bottom here is super important. If you haven't consumed a THC product that's been commercially produced, your idea construct of cannabis is so antiquated that it's irrelevant. So I think it's super important to understand cannabis has changed dramatically, and we'll talk about that. So, exploring trends, there's a 12-month prevalence. What we see is that it's increased since 2017 and it's gone up. It went down during the pandemic, but it's kind of, yeah, it's there. There's been an increase over the past 8 years, 7 years or so. So it's just a growing problem, and something that we, are aware of and trying to address. So just a couple basics. I'll get more into this in just a second, but it really is cannabis. That's the name of the plant. The active ingredient is tetrahydrocannabinol, or THC. And there's also CBD, which can be prevalent in that, which is some medical benefits without the high. I'm not going to talk about that today. If you want more research on that, we can definitely get that for you. But what's important to understand is that cannabis has changed dramatically. So, y'all are definitely, not that old. I don't know, maybe you are. In the 60s and 70s, right? What we were seeing, right, is they were around, the THC levels was 1%, right? The good stuff was 1%. Now what we're seeing is in the 80s and 90s, it increased, and today the average like dried flower, which is this picture here at the bottom, which people smoke, which lets off that odor, right, is oftentimes 16%. The trends that I see, right, with people going to dispensaries and things like that, you're looking at around 20, 25%, right, upwards to close to 30 on the really good stuff. What we see people using a lot more of is using these THC oils or waxes, and the THC percentage on these oils and waxes can be anywhere from 40 to 99%. And so we'll talk a little bit more about that and the risks that can kind of come with that. Um, I just briefly, wanted to talk about what students in Lower Merion were vaping. I struggled, we're going to talk about vaping cannabis, vaping nicotine. I wanted to put this in here just so that right? What we see in sixth graders is they say that they're just vaping flavoring, and those slowly decrease over time. If you look back at your last year's or 2 years ago PAYS data, the number for I don't know in sixth grade was super high, and now that number is 0. And so I'm just hypothesizing here about why that might be the case. Maybe, this group, says it's just flavoring. Maybe they don't know. Maybe they're buying it. Maybe it's the sleep stuff. Not entirely sure. But it's important to kind of understand kind of what people are putting into their bodies, right? And so we think about these 0 nicotine percent. Whoa, wait, 0 nicotine. I clicked. I didn't mean to click. 0% nicotine, right, for sixth grade, but we're seeing just flavoring or marijuana or THC. These trends that we're seeing here, that 11% for 10th graders not knowing what they're putting into their body, it always concerns me, right? 25% for 8th graders, and having that conversation of what are you putting into your body? It's super important to be mindful of and aware of. So parents having that conversation of not putting, unknown substances into your body, is always super important to do. So vaping cannabis, we'll talk a little bit about this. So there's the dry herb vape, which we've seen a little bit of, but what we're seeing more of, right, is these THC wax and dab pens. There's more of an odor with the dry stuff. And so oftentimes with these waxes or these oil pens, what we'll see is that they'll be vaped, and what ends up happening is that there's less of an odor, and it's easier to maybe get away with or maybe hide some of that substance use. And what we saw, right, is that those are the higher, these oil pens and these wax pens are often that higher percentage point of THC. And so what happens is that the adolescent developing brain, which I'll talk about here in just a second, is getting exposed to really high levels of THC, which can have psychoactive components to it and can lead to a whole slew of different issues. So it's caused a whole the use of wax and oil by adolescents and teens is very concerning for a variety of reasons, which I'll talk about in just a second. Cannabis withdrawal is something to be, just mindful of if I know teenagers maybe could have some of these things throughout all of being a teenager. I know being a teenager is hard, but if there's more so than normal restlessness, irritability, anxiety, depression, weight loss, appetite disturbances, important things to look out for. And I'll give you some more tools of what you can do if you notice that. So, dangers of cannabis use. Okay, so we talked a little bit about this, but in the short term, there can be a lot of different issues that can kind of happen with that. We can have paranoia, we can have impaired motor skills, we could have psychosis, right? Hallucinations, right? And so psychosis, boiled down to is it's experiencing things not in reality, right? Oftentimes. And so what's happening is sometimes individuals might use cannabis and use those oils or waxes, and they don't know how powerful it is, and it can immediately send them into psychosis. So I always, again, delay usage for as long as possible. And I always tell, people, if you're, when I do the presentations with kids, I always tell them, like, if you're going to smoke the flower stuff. Do not, your first time, if you're ever going to smoke, right? The first thing that you should do is always the flower stuff. We don't know how you're going to react. You might have a genetic component. You might be predisposed to go into psychosis. If you use these high things, you can stay in psychosis for a long time. And so, I don't encourage substance use. I never want, you to think that, but if they are going to use a substance, I want them to be very mindful that they're not just going right for the highest thing that can be really detrimental to that. With that being said, right, long term, there's a lot of complications and a lot of issues that can happen with substance using cannabis. Thinking about athletic performance, work, mental health problems, the schizophrenia, other psychosis. This is a big one, right? And I brought it up multiple times, not to scare, but I think it's what we've seen a lot of. It's important to understand. And then addiction, and I'll talk about that here in just a second. Individuals who use cannabis early are more likely to developing a cannabis use disorder. If they use cannabis before the age of 18, they're 4 to 7 times higher likelihood to have a cannabis use disorder than those individuals who began using cannabis in adulthood. So that alone right there, right, just re-emphasizes that delay usage. Now, I just, wanted to talk about Lower Merion and the PAYS data that we see here. This was really interesting to me. We look at the jump in 12th graders from 2021 to 2023. If you look at the 10th and 8th graders, you're well below national averages, right around state averages for 10th and 12th graders. And it just goes back to that importance of being consistent with the messaging and continuing to provide. And, you can share some of the information and facts you learned today around waiting until they're older to use. And maybe that is what's happening. But that jump, it always makes me curious and makes me, question, like, from, maybe you have children in younger grades, has the messaging changed? Has any of that changed? So I always just, for you, I think it's important to kind of think about that. These next things I'm going to go through pretty briefly, just because I think it's important for you to have the information on this. But it's important to look at prescription meds and over-the-counter meds and the impacts that those have on individuals. This is a big fear that's happening. We'll talk about it with fentanyl, but over-the-counter drugs, right, is oftentimes, we're looking at that's going into a store and buying cough medicine, maybe buying Tylenol, Robitussin, some of those over the counters can mimic or have similar effects as some of the illegal drugs, and so sometimes people might use these. What we're seeing is it's more prevalent in younger age, and so I think it's important for middle schoolers, right, middle school parents, right, to be aware of that, to be aware of your medications that you have in the house, which I'll talk about in just a minute. Adderall usage as well. This is an important one to be mindful of, but those not being prescribed it. So if they're prescribed it, that's not included in here, but people who aren't prescribed it and are using it recreationally, just looking at that and what that looks like. I just wanted to briefly talk about at Lower Merion School District what we're seeing, right? This is lifetime prevalence usage for prescription drugs at Lower Merion School District. These numbers are pretty good, and they're right on or lower than national averages. And so the messaging that you have around this is great, and just continuing to be mindful and aware of any unused substances or medicines you have around the house and disposing of them. If you're not sure what it is, right, maybe some pain pills or prescription stimulants, anything like that. If you're not using it anymore, taking it to a doctor, or a pharmacy to dispose of properly. I know the CVS by me has a drop box where you can drop any unused meds. Police stations also do that as well. The other thing to be mindful of is over-the-counter drugs and any of those that you have around the house. If your kid is constantly going through those, to be mindful of that as well. But just really being aware of these prescription drugs, prescription stimulants. I think the messaging that you've been doing is great, and just to continue that. But always we can be more mindful of any unused substances and making sure that we're disposing of those properly. So fentanyl, fentanyl is you've probably seen it in the news. It's probably been talked about a lot, but there's the pharmaceutical and then the illicitly manufactured fentanyl. They're synthetic opioids. It is used, there's a medical component to it to help after surgeries. It is kind of on the streets. Y'all are not, Lower Merion are not really experiencing much of that. But what I will say is that it's super important to be aware of what fentanyl is and be aware of any overdoses that might occur. So with that being said, an opiate overdose will oftentimes have like pinpoint pupils, so you can look into their eyes and see it's very, very very, very small. The opiate is going to affect the central nervous system by slowing everything down. So oftentimes it'll cause individuals to fall asleep, stop breathing, get cold, they'll become pale. And so if there's ever an overdose happening, it's super important, to call 911 immediately if something like that does happen. And so we've seen an dramatic rise in overdose deaths as reported on the Monitoring the Future survey. And so one of the things that we can do to combat that is kind of what I talked about earlier, is making sure that our kids know what they're putting into their bodies. So having those conversations, if you don't know, don't do it. And I think one of my favorite activities that I do during some of my presentations is I'll have a cooler of Kool-Aid, and in one I'll put sugar and one I'll put salt, and I'll be like, well, which one do you want? And they'll take whatever. I've gotten the salt one every time I do it, and it is disgusting. But I think it goes to show, just you never know, right? A red Kool-Aid cup looks like red Kool-Aid, and it could be drugs and it could be alcohol, things that you just don't know. So if you don't know, don't use it. And just being consistent with that messaging. I think sometimes examples can be really beneficial to illustrate a point. Teachers can probably agree with that. So we get to the stuff that you're probably like, thank goodness you're getting here, Cordis. What can you do? So I think a couple of things that I'll kind of message throughout is talk early and often, be consistent, and ask for help if you're concerned. This is not easy. Having these conversations, doing this is not easy. And so I just want to acknowledge that from the start, that this is not an easy thing to do, but talking about it early and often, being consistent in what you do, and then being vulnerable and asking for help if you don't know. So talking early and often, parents, caregivers, you're the number one influence on your child's relationships with drugs and alcohol. You your relationship with it, your conversation about it is super important to know. I always, again, like I've talked about throughout this entire presentation, the main way to prevent addiction is to keep them from using it. May or may not be possible, but delaying their use for as long as possible. Have those conversations as early as possible and make sure they're age appropriate. Do not give away your power about helping your child. If you don't talk to them and answer their questions, they will turn to their peers, and their peers might not have the facts. Their peers might not have the information that you do. So keep your power, have these conversations with them. So some conversation tips that I found to be beneficial, I think, as kind of talked about from the beginning, is consistent messaging throughout all of the conversations you have is important. Um, we talk about finding a comfortable setting, not saying like, okay, we're going to talk after dinner, but finding it to come up in natural ways. I love, maybe with a young kid, it's like you see a cigarette butt on the ground. It's like having an opportunity for that, or you see a beer commercial on TV or whatever. You're on a walk and something reminds you of something, having that conversation with them. Be calm and relaxed. It can be uncomfortable. It can be really difficult, but just do your best to be, clear about your views, be succinct, be positive, be open-minded. I think this is an important piece, is don't just lecture at them, but keep an open mind, be willing to hear what they say, right? What they're saying. And I think it's important to be able to combat maybe some of the misinformation that they may have of, oh, everyone's doing it, or, what is being said. Know what you want to get done, know what you want to accomplish in these conversations, and then use active listening. I think this is a big one that, in general, but what active, as parenting, right? Active, I'm not here to tell you how to parent. That's not at all what I'm here to do. But active in listening is something that we use in the counseling and psychology profession, is involving open-ended questions, being positive, making sure, restating what they said in a way that makes them feel like they were heard and valued, and then asking them if they want advice, asking them if they want, to be listened to, asking them what they want and need. So it's really difficult. It's really challenging having these conversations, but these are some helpful tips that you can engage in. So real briefly, I'm going to go over just a couple different age groups, and then we'll wrap up here in just a second, and answer some questions here. I am aware of time here, so I know I know y'all are still with me, so I appreciate that. For preschool age, really just kind of going through some of these. I think having them starting to take some responsibility for their own health and what that looks like for a preschooler, right? Could be as simple as brushing their teeth, right? Or, not having mac and cheese every meal, right? Or what that might look like. Helping them through their frustrations positively, helping them, deal with some of the difficulties that they face. And going through that. I won't go through all these ones for the sake of time, but here are some good examples that you can do. For 5 through 8, getting in that elementary school age, right? Having these conversations about substance uses and when they're age appropriate, right? Finding out when they are appropriate. This could be a great opportunity to talk about medication, right? And that's prescribed if they're starting to understand what's happening. Children at this age, from a developmental standpoint, struggle with understanding what other people are going through and what other people are experiencing, right? So it can be really beneficial for you to kind of just have kind of conversations with them about where they're at. Start talking about your expectations about them and substance use, kind of what that looks like, and kind of what all this is important. I don't want to I could talk about this for hours, but I want to be respectful of everyone's time. This last one here, though, is getting to know their friends and their families. I think, like I alluded to earlier, knowing what's going on at other people's houses, right? Especially if you're going to be in that area, right? Knowing what their views are on substance use, right? And maybe it's not, the first time you meet him having that conversation, but as you slowly, recognize who your child's friends are as being your child's friends are their parents, if you have a relationship with them, being able to have those conversations. Ninth and 10th, 9 through 12, right? So we're getting closer to that middle school age, right? Making sure there's those expectations and there's those consequences. And I think what's super important about this is it being clear and being enforceable, things that that you can follow through on. This other one here is practicing refusal skills. If you want your child to, if your child wants to be good at taking a test, they study the night before, right? If they want to be good at a sport, they go to practice. If they want to be good at an instrument, they practice on their own, right? So if we take out the impulsivity, spur of the moment decisions, we practice these refusal skills with them, they're going to perform better when they are tested, because they will be tested. They will be maybe given an opportunity to use a substance. So if they're prepared, they can make a better informed decision. Give them the facts, right? Don't let their friends give them the facts. You have that power. So making sure that you can do that for them. Again, here, age 13 through 18, right? We're talking about that high school age. Make sure that those rules and consequences are very clear. Clear disapproval of substances. Again, these 3 bullet points I added just because I want to make sure that, where people are getting substances. I think it's important that you as adults at this age and even younger, right, is you make sure that you're not providing those substances. There are serious legal consequences for that. I won't get into them, but there are serious legal consequences for furnishing alcohol or other substances to a minor. Older siblings, this is a big one. Older siblings can oftentimes be the one that might provide an alcohol if they're over 21 or have a fake ID, making sure that they are aware of your expectations and rules around that. And then, like we talked about with the over-the-counter substances, making sure that those are secure. Be ready to listen. Be ready to have these conversations. Be ready to engage with them and have some of these difficult conversations. Real briefly here, here are a couple alternatives to how was your day. I know maybe you pick them up from carpool or you see them when they come home. Maybe that's, that question gets, good, fine, whatever it might be. But here are just a couple different ones that you could do. If you want to take a screenshot of it, you're more than welcome to. But just, again, this will be online, but just a couple great ones to have. That could be fun to have kind of a conversation around, than the typical how was your day. Possible conversation starters for around substance use, right? Here are a couple other really great ones that you can do to kind of start that conversation, maybe that you find beneficial, right? If your friend wants to try a drug, how would you handle that? Oftentimes I'll hear people say, well, my friend, was doing this. Oftentimes it's not their friend. Oftentimes it's them. And so just being mindful of what's going on with that. And, if they say like, well, my friends are, great. They really value their friends. And so just being mindful of how we say that, and have those conversations about their friends. Excuse me, I'm losing my voice a little bit here as I keep talking. Just a few more slides and then we'll get done here. Resiliency is a big reason why people can overcome this. And so 3 external factors that you can influence are opportunities for healthy activities. So finding ways to help them engage and contribute, teaching them skills so they can be successful, and then recognizing them to help them establish their own self-worth. So if maybe they've said no to substances before, recognizing them, doing that can be super important. Question I get a lot is what happens if they say did you use drugs or alcohol? You know your kid better than anyone, right? Some kids want that candor. Some kids, maybe you can steer that conversation a little bit differently. They just want to talk. Trust yourself. Trust yourself in those conversations. At the end of the day, this isn't about you. This is about your kid, and how you want to handle that is really up to you. But just know your kid, know what your kid needs to hear around that. Last couple of things to be mindful of: if you notice any physical changes in productivity, behavior, attitude, or you notice paraphernalia, anything like this that's happening, there could be something else going on. There could be, if they're sleeping more, there's changes in what they're eating. There's red eyes all the time. They stop doing work. They don't care about their schoolwork anymore. They change their friend group all of a sudden. All things to kind of be aware of, to be mindful of. If you notice these things, we'll get to that right now. If you suspect use, take action. Trust your gut. You are smart. You are capable. You are, doing your best as a parent. Trust yourself. Trust yourself. Trust yourself. Take action. Even if it feels like something's going on, trust yourself. Have that conversation. Talk to your child about it. Investigate a little bit further. You can search their room, search their backpack. You can do drug tests. There's definitely different places that you can do that around. If you don't want to do that, you can buy one at your local pharmacy. Probably help if I put this bullet point up. The biggest one here, that I always kind of talk about is seek professional help. If you are unsure of what you're doing, there's professionals that can help with this and with this situation. People at Lower Merion School District can help and support with this. The other thing that you can do is, we have our information here at Caron. You're more than happy to reach out to us here at Caron. We have a teen outpatient group meeting in King of Prussia, which is just a little bit away from you, or not King of Prussia, Plymouth meeting, excuse me, just a few minutes away from y'all, more than a few minutes, but 20-30 minutes away. A couple things that you can do: eat together, don't buy into the teen stereotypes. Everyone's doing it, and then be balanced. A couple other things here that I'll leave you with, and then I'll open it up for questions here. This right here is some free resources. So if you want to look at what we're doing with Caron and our Education Alliance team, you can more than welcome visit our QR code, and we have a ton of different resources on there, more training programs and things like that. If you want to stay up to date on current trends, you can sign up for our e-newsletter, as well as other things that we do. We offer digital learning as well, so if you're interested in learning more about that, you can look into digital learning. I just recorded a podcast with the people at Caron talking about transitions and the challenges people experience going in from transitions from lower school to middle school to high school to college, and just the challenges associated with that. Ton of great resources for free on Caron. We are incredible at providing information, making sure that you're informed as parents. It is so hard to be a parent. We recognize that. We understand that. So we offer these for free. Try to make them bite-sized, 3 minutes, 5 minutes. Maybe you have that time to take a look at it. This is a Connect 5 program, which looks at nicotine usage. It's created for nicotine cessation for youth. It can be really great and have a great impact on use. I can, pass that information along. You can sign up for free on our website as well. And then here's a video series that's in here. There's a video by me. I look like a ghost in the thumbnail. And that is looking at and kind of talking about different 3-minute videos that you can look at about powerful parenting. Can be really beneficial. The podcast that we have that I was featured on a little bit ago, another great resource if you're in a drive, you want to learn more about substance use or just parenting in general, what that might looks like. Feel free to check it out. All of these are just really great resources for you to have. We always say that when you know better, you do do better. So we just want to make sure that you're well informed to make these good decisions. You can follow us on Facebook if you want, or Instagram. We're on the internet out there as well. So feel free to follow us. But other than that, oh, there's our QR code for that. Excuse me. Last thing I have is just thank you. We'd love to see how you felt about this. If you would like to leave any feedback or leave any information, you can take that QR code and do that. The other thing that you can do, if you wanted to reach out to us, you have any concerns, maybe privately, you can reach out to us at our Education Alliance at Karen, or call us at our phone number at SAP. With that being said, I know I left about 15 minutes for questions here at the end. I want to make sure that we're respectful of everyone's time, but I want to thank you all for listening. And Robin and Cicely, I'll answer any questions that may have come up to the best of my ability.
Sorry, Cordis, I want to thank you so much. I got so much out of that. I almost forgot to turn on my mic and video because I was taking so many notes. So thank you so much. It was very thorough. Really appreciate the conversation around just even having conversations. And Megan, I didn't know if you wanted to make a few comments as well as Robin. And then after that, we can start with the questions.
I really appreciate your time, Cordis. This was really informative, and I think it will help launch the conversation in Lower Merion when we dive deeper into the Lower Merion specific data. But I think the context you provided is super helpful, and it's because this is recorded, it will be an opportunity for us to point folks back to this conversation when we present our data to our community as well. So thank you for that, and appreciate your time.
All right. We have some questions in the chat.
Sure.
So the first question I have here is Borg use still occurring at high school and college level? And I had to ask what Borg was, so it's
Yes.
yeah.
So
yeah.
Borging is I don't know what the acronym stands for, but I believe it is where it's when you take a jug, dump out some liquid, and you have your own like container alcoholic drink that you might carry with you throughout the day. So I think I have that correctly.
Yeah, it's the person defined it as black outrage gallon. So
Yes, yeah, that's what the acronym stands for, blackout rage gallon. Yeah, okay, yeah. Yeah, so I'm not entirely sure about, what the current trends are. I haven't been to a high school party in a couple decades now. But I do know, right, that what we have seen, it goes back to that binge drinking. I don't know specifically what is happening, but oftentimes it is these flavored drinks. Those gallons that they're drinking is oftentimes filled with Mio or one of those. I'm Mio. That's I'm aging myself. It's one of those things that you squeeze into the bottles that make it taste so it's not like alcohol. So I really think that's kind of what we're seeing. I can't speak specifically to the if that's happening on a consistent level. If I had to guess, I would imagine. I know binge drinking is happening. I can't say specifically whether Borging is or not.
And then how are you able to gauge if the kids are answering the PAYS questionnaire honestly?
Yeah, that's a great question. And so there are a ton of different ways that they do this. So I'm learning all about psychometrics and all about the fun nitty gritty of collecting data. I'm currently getting my doctorate in what I understand and about the PAYS data is they analyze it, they scrub it, they look through it, they look for any anomalies that are happening on certain tests, right? So if a kid answers yes to using every substances ever and like all this stuff, that data gets thrown out. What we've seen is that this has been happening for a long time. I don't know the exact amount of years, but the data has been pretty consistent. I have the report in front of me here, but it's been pretty consistent for what's been happening. It's been the 17th biennial administration. So it started in 1989, and it's been going on for 17 years now. And so what we've seen is that data has been consistent over time. They've worked on making sure that there's measures in there that check that the kid's not just answering yes, 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 or no, 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 and really going through there and having some safety measures, I guess, to ensure that it's not just being filled out poorly.
Another question here is, I've heard of parents who allow their late teens to have some wine occasionally during holidays or as a way to counter the kids' curiosity and doing what they are not allowed to do.
Yeah.
Legality aside, what's the impact on the kids?
Yeah, that's a great question. I think I don't want to speak generally and say that at large, right, what's going to happen from that. I think it's a case by case basis. I think it depends on the kid, right? If you know that your kid is, curious about drinking and maybe wants to drink, but you've had conversations with them of like, hey, I only want you to drink in my presence. I only want you to drink with me. That's a conversation for you and your family to have around what you think is appropriate. I know some people think like, hey, I'd rather them drink at home with me than drink, out at a party binge drinking. Some people have a lot of different opinions around it. Again, I'll fall back on delaying use for as long as possible, right? Granted, a glass of wine is better than binge drinking. Obviously I'm still I still wouldn't be doing my job if I condoned any alcohol usage, right? I really would advise waiting until that brain can be fully developed. With that being said, it is a personal decision, right, for you and your families, around taking what you think is best, and knowing your kid, right? If you know that your kid is going to experiment and explore with it, and you know that they maybe have some other stuff going on, having them do it in the safety of your own home might feel more comfortable for you. I will say, just I tell all parents this, making sure that you're addressing your own fears, your own stuff, your own mental health stuff, whether anxiety or depression that you may have around it. I know for me, like there's fear, right? Like I'm an alcoholic, right? Like, I'm saving up for my kids' treatment already, right? Just from that genetic component, right? And so I just think about that and what that looks like. And so I think it's just super important to be mindful of that and aware of that it is a personal decision. Where it can get dicey though is that when they start giving alcohol to other people's kids, what that can look like. And so I really, really advise against that. Really suggest not doing that for the legal ramifications of furnishing alcohol, but then also the social what is the word, the fallout, the social fallout that can happen if I've seen this at one of the schools I've done presentations at. There was a huge issue and a huge social fallout from one parent providing alcohol to other teens, and just bullying and all sorts of stuff that kind of stemmed from that. So again, not really answering fully your question, but I think kind of as comfortable as I feel in answering that, I don't want to generalize and say yes, it's okay, no, it's not okay. Knowing your kid, knowing your situation, but I will again reemphasize delaying use for as long as possible.
There's another question here is, do you see a correlation between drug and alcohol abuse and gambling addiction? There's a lot of advertisements now that gambling is kind of online at your fingertips,
Yeah.
24/7. It's on um, every sporting event. You will see some kind of gambling advertisement. So just wondered if you could speak to that a little bit.
Yeah, that's another great. Y'all are filled with great questions. I feel like Laura Marion always has some really great questions. So thank y'all for asking these. This is something that we as mental health professionals are really kind of monitoring and being aware of, and gambling addiction especially. as it pertains. I'm going to go a step further, right, and say social media in general, but gambling is obviously its own thing, but technology and what that's looked like and the availability of technology everywhere, and kind of what that does towards mental health in general. I believe the DSM is working towards kind of some diagnoses around that. I can't say if there's any causality between the two. I don't know the data off the top of my head. I can speak anecdotally, that I do know a lot of people that I, interact with, a lot of men. I'll speak for men. I feel like it's probably more prevalent in, male sexes, could be female sexes too. I don't know, but a lot of the men that I do know, my age group and younger are engaging in sports gambling, whether that's fantasy football or betting on games. And so it's something to be aware of and be monitoring. And I think it goes back to that, like, what are our kids doing online, right? What's happening online? Are we aware of that? And I think a lot of it, the ads on TV are not helping, but also social media in general. What kind of information are they consuming on there? Whether that's from gambling, drugs, alcohol, things like that. Just being really mindful as parents of the media that they're consuming.
So another question here is, can you speak to any recommendations of students who have ADHD and delaying substance use, as we know their brains, especially the frontal cortex, are slow to develop? I think the person says they think that it's a 2 to 3 year lag for students
Yeah.
who have those disabilities.
Yeah, so I can't, give specifics, right, for that individual, but I can speak broadly, right, around ADHD. And oftentimes there's, two different types, right, with ADHD, but oftentimes impulsivity is one of the things that we see, right? And so impulsivity is, I mean, to define impulsivity, right, is the not thinking through choices, right? And so oftentimes when it comes to substance use, right, if someone is offered or presented a substance, we could have a conversation with them around what are they going to do? What are they going to say? Right. If you're offered a beer at a party, like, what might you say? What might you do? How can you be as prepared as possible to handle that? And so I think a little bit about, from the impulsivity piece of being as prepared as possible to make those decisions, is one of the small things that you as a parent can do, and having those conversations, having, um, hey, like, what are what might you say if you're at a party this weekend and someone asks that? What might you do? With that being said too, if the ADHD is not being addressed, by a licensed professional, I would suggest that, whether that is either medication or, talk therapy with a licensed professional. I would recommend that as well, to continually have some of those, coping strategies that you can help and kind of deal with, because untreated, right, like that we saw, can lead to, more likelihood of, addiction. So I think from a parent standpoint, it's having those conversations with them, and you being aware of when where they might be at risk, right? So if they're going to a friend's house, like, hey, what are you going to say if so and so happens? So and so offers this. What are you going to say if this is presented? And so helping it from that standpoint, but then also making sure that you're addressing it and treating it, from a professional standpoint as well.
And are there specific interactions with some of these drugs with the ADHD medications that are particularly dangerous for students, that they might not know about, or parents might not know about?
I guess Roman, I'm a little confused by the question. Are you
Yeah.
asking if there's a specific drug that they should be mindful of that are more likely to have?
Well, yeah, I guess in general, are
Yeah.
some ADHD medications more like, have more reactivity to, like,
Oh,
if you do marijuana, or does it change the effects of alcohol, or
I can't speak to that. I don't know enough about, I'm not a psychiatrist. I can't speak to medication impacts. And I don't know the research well enough to give a confident answer around happens. If ADHD, certain medications can lead to this or that. But if there's a prescribing, whoever the prescribing doctor is of that medication should, in theory, know that and be able to provide a better answer than I can around that. I do know that it is, ADHD medication is often stimulant based. There's some that aren't. And so just kind of knowing, okay, well, what's kind of going on, with a stimulant, right? It's affecting the central nervous system. It's speeding everything up, right? In their brain, are they thinking, oh, I need to self-medicate, slow things down or speed things up? I don't know. And I don't want to hypothesize just because I'm not sure and don't want to put my foot in my mouth. I'm sure I've already done it a couple times tonight. So
Yeah. So are there any other questions? Kind of last call for the chat. Pops in.
I'll just say something here at the end. If you have any other questions or concerns, please don't hesitate to reach out to Karen. We are really passionate about ending substance use, ending addiction. We want to help you. We want to support you. It is so hard to do by yourself. And so know that there's no shame, there's no judgment on our end. If you ask for help, you ask for support. I want you to know that you're not alone, and we'll do everything in our power to help you and support you navigate through this, because this is really challenging. This is really difficult, and it sucks doing it alone.
So we have some ending comments. It's just thank you in the chat multiple times for all the information, and I want to thank you for your presentation and speaking to us. And we will end the recording now.